Now let's hear from our first presenter, Mr. Mohammad Ahsanul Alam, Evaluation Specialist from NIPORT.
Rahim, Honorable Chief Guest, Mr. Muhammad Zahid Malik MP, Honorable Minister, Ministry of Health and Family Welfare, Government of the People's Republic of Bangladesh. Honorable Special Guest, Professor Nasima Sultana, Additional Director General, Directorate General of Health Services. Honorable Special Guest, Ms. Shahan Ara Banu, Director General, Directorate General of Family Planning. Honorable Special Guest, Mr. Justice Sidwa, Director, Office of Population, Health, Nutrition and Education, USAID, Bangladesh. We have with us Dr. Tahmid Ahmed, Executive Director of icddr as guest of honor. Respected Chairperson, Mr. Sushanto Kumar Saha, Director General, NIPORT and Additional Secretary of the Government of Bangladesh, distinguished representatives of development partners, fellow colleagues and participants, representatives from print and electronic media, ladies and gentlemen, Assalamu alaikum and a very good afternoon. It is my pleasure to start the presentation of Bangladesh Adolescent Health and Wellbeing Survey 2019-2020 findings. Firstly, let me introduce Bangladesh Adolescent Health and Wellbeing Survey. The 2019-2020 Bangladesh Adolescent Health and Wellbeing Survey is a national survey that is first time conducted in Bangladesh. This could be a prime source of population and health data for Bangladesh. Hope the survey results will be widely used by policymakers, by program managers, by health planners, by researchers, and internationally to improve programs, identify areas of need, and to monitor Bangladesh progress on the move to the better health. Why adolescent survey? In Bangladesh, adolescents aged 10 to 19 years constitute over 1/5 of the total population. The Ministry of Health and Family Welfare of the Government of Bangladesh recognizes adolescent health as a critical areas of focus and has the primary responsibility for addressing adolescent health needs. The ministry developed a national strategy for adolescent health 2017-2030 with the goal that by 2030, all adolescents in Bangladesh will attain a healthy and productive life in a socially secure and supportive environment. This survey was initiated to have a better understand the state of adolescent health and well-being and the needs of this population. Bangladesh adolescent health strategy focuses on 4 health areas. These are sexual and reproductive health, violence, nutrition, and mental health. The Adolescent Health and Wellbeing Survey was designed to gather information on all these 4 topics. The 2019-20 Adolescent Health and Wellbeing Survey was conducted by National Institute of Population Research and Training NIPORT under Training, Research and Development Operational Plan of 4th Health, Population and Nutrition Sector Program of the Ministry of Health and Family Welfare. Survey data was collected by a private research firm, Human Development Research Center, and survey was funded by the Government of Bangladesh and USAID. Some support was also provided by UKaid. Research for decision makers of icddr data for impact of the University of North Carolina at Chapel Hill and USAID Bangladesh provided technical assistance in all phases of the survey. The objectives of Bangladesh Adolescent Health and Wellbeing Survey was to examine and understand the state of health and well-being of adolescents aged 15 to 19 years. Adolescents younger than 15 years were not included due to the sensitive nature of some of the survey questions. The specific objectives of the survey were to document exposure to print, electronic, and social media, assess knowledge, attitude, and practice regarding menstruation, marriage, and contraception, measure the institution status, understand use of health information and services. Okay. Assess connectedness of family and friends and assess the mental health. Survey design. This is a nationally representative sample survey of over married female, ever married female, unmarried female, and unmarried male adolescent age 15 to 19 years. And survey was designed to provide estimates for national level, rural and urban areas, and for the western, central, and eastern region of Bangladesh. Here, western region is we covered Rangpur, Rajshahi, and Khulna divisions. Central region we covered Mymensingh, Dhaka at Borishal divisions, and eastern region we covered Chattogram and Sylhet division. The survey followed a two-stage stratified sampling design. In the first stage, 736 primary sampling units or clusters were selected for the survey. All households in each of the primary sampling units were interviewed to identify eligible adolescents. From a total of 72,800 households interviewed, 5,066 ever married girls, 8,282 unmarried girls, and 6,538 unmarried boys aged 15 to 19 were selected for the survey. The survey data collection was completed in 5 phases. Data collection started on 25 July 2019 and completed on 10 January 2020. 126 field staffs in 18 teams were involved in data collection activities. The household response rate of the survey was 98%. For ever married female adolescent, the response rate was 97%, and for unmarried females, it was 94%, and for unmarried males, it was 85%. Today's dissemination, we decided to have the results of this survey presented to you by a group of adolescents. Let us hear from them what their peers have said. We are excited to have 10 young volunteers who sat with us for the first 2 weeks and prepared themselves to share the survey findings. You can see their names on the slide, and they will also be introduced as we go through the presentation. We hope there will be a wonderful presentation from young presenters. It is a new initiative. Dr. Kanta Jamil of USAID Bangladesh played a central role in thinking, designing, preparing, and guiding these young presenters for presenting the survey findings. We are grateful to her. Now, I would like to invite Rahela and Sheherin to begin the presentation of the survey results.
The survey collected basic information from all respondents interviewed that will help us to understand some characteristics of the adolescents. We shall present information on respondents' living status, schooling, work status, adolescents' involvement in extracurricular activities, and their affiliation with social organizations and adolescent programs. Living status of married adolescents. Just over half of the married female adolescents live with both their mother-in-law and father-in-law. About 15% live with their mother-in-law and another 2% with their father-in-law. Living status of unmarried adolescents. The majority, 80% to 84% of unmarried adolescents live with both their mother and father. There are also households where only one parent is present. 11% to 13% of unmarried adolescents live with their mother and 2% with their father. Around 4 to 5% of unmarried adolescents live in households without their parents.
Current schooling. There was considerable variation in schooling status among the three groups of adolescents. Overall, 98 to 99% of adolescents have ever attended schools. However, the majority of married girls, 83%, discontinued schooling. In comparison, school dropout is much lower among unmarried girls, only 15%. Over a quarter of unmarried boys, aged 15 to 19, discontinued going to school. Thus, at the time of the survey, unmarried girls were most likely to be attending regular school or madrasa, and ever married females the least likely. The adolescents who dropped out of school stated variety of reasons for discontinuing schooling. The main reason for ever married females to discontinue school was marriage, cited by nearly 3/4 of them. As for unmarried females, financial constraint was the most commonly cited reason for dropout, followed by 30% stating they lacked interest in schooling. For unmarried males, lack of interest served as the most common reason for dropout. Also notable is, half of the unmarried males dropped out due to financial constraint.
Work status. At the time of the survey, nearly 1/3 of unmarried males were working for cash. This proportion was much lower for unmarried females and ever married females, at 12% and 6% respectively. Extracurricular activities. All adolescents were asked whether they participated in any of the specified extracurricular activities like drawing or painting, singing or dancing or drama, reading books other than textbooks, creative writing, and outdoor sports. The vast majority of unmarried males are involved in outdoor sports, and nearly half stated that they read books other than textbooks. Over half of unmarried females are involved in extracurriculars, with the most common activities being reading books and drawing and painting. Only 1/4 of ever married females participate in extracurricular activities, with reading being the most common activity among those ever married females that do participate.
Involvement in social organization or adolescent program. Unmarried boys are more likely to be associated with social organizations than unmarried girls. 22% of boys, compared to 14% of girls, are associated with any social organization. Only 2% of ever married females are affiliated with social organizations. Affiliation with adolescent programs is generally lower than with social organizations. Only 1 to 5% of adolescents participate in any kind of adolescent programs.
To summarize, about half of the married females are living with both parent-in-laws, while 80% of unmarried females and males are living with both parents. 98% of adolescents have ever attended school. However, 83% of ever married female adolescents discontinued schooling mainly due to marriage. Over a quarter of unmarried boys dropped out mainly due to lack of interest and financial constraints. School discontinuation rate was the lowest among unmarried girls, and it was mainly due to financial constraint. Almost 90% of unmarried boys are involved in any extracurricular activities. adolescent girls are less likely to do so. Only 2% of ever married females, 14% of unmarried females, and 22% of unmarried males are affiliated with any social organization. Around 1% to 5% of adolescents are involved in any adolescent program. We now invite Ahbab and Maisha to present the findings on exposure to mass media.
Exposure to mass media. Understanding adolescents' exposure to mass media is important because the role that media plays in disseminating health and other information to target audiences. The topics covered under this section are adolescents' exposure to various types of mass media, their exposure to adolescent health programs or materials, and adolescents' desire for additional information on specific issues. Access to mobile phones. The growth of mobile phone use is a key development in the field of communications and information technology. Adolescents' access to mobile phone is over 90% either through own mobile phone or through having access to household mobile phone. Ownership of mobile phones. Ownership of a mobile phone is highest among unmarried males, where 71% own a mobile phone. 52% of ever married females own a phone, while 22% of unmarried females do so. Ownership of mobile phones by type. Among the ever married females, equal proportions own a smartphone compared to a basic phone. Among unmarried females, 14% own a smartphone compared to 8% owning a basic phone. Among unmarried males, 45% own a smartphone, where 26% own a basic phone. These figures are important, since those with access to a smartphone can easily access the internet and news, as well as use social media applications like Facebook, YouTube, and WhatsApp. Use of cell phone. Text messaging remains the top use of mobile phones among all three groups, although unmarried boys are much more likely to use various mobile phone applications than the girls.
Exposure to mass media. Adolescents were also asked whether and how frequently in a week they watch television, use the internet by means of a computer or mobile phone, read newspaper or magazines online or printed copy, and listened to the radio. Exposure to television is the highest among all three groups of adolescents, followed by internet. Unmarried males are most likely to be exposed to each of the four mass media, and ever married females the least likely. Exposure to adolescent program in the last 3 months. Adolescents were asked if they had exposure to any adolescent programs or articles in the 3 months preceding the survey through medium like TV, radio, online, or print materials. Exposure to adolescent-related programs or materials is 15% among ever married females, 25% among unmarried females, and 20% among unmarried males. Desire for more information. All unmarried adolescents were asked about whether they wanted to have information on specific health topics. Desire to have information on health-related matters is quite high. 73% of unmarried girls desire to have information on puberty and physical changes, and 66% wanted to know about menstruation. Over half of the unmarried females wanted information on family planning. Among unmarried males, 66% wanted to know about puberty and physical changes, 57% about family planning, and 52% about wet dreams. Most preferred source of information. Respondents were also asked about their most preferred source of information among a specified list that included teachers, books, TV, radio, the internet and mobile phones, newspapers or magazines, a hotline, and health providers. For unmarried females, books were the most preferred source of information on health related topics like puberty and menstruation. For information on family planning, their preferences were books and health providers. Unmarried males preferred the internet or mobile phones for learning about physical changes, wet dreams, and family planning.
To sum this all up, 7 out of 10 unmarried boys own a mobile phone. Around half of ever married females and a quarter of unmarried girls own a cell phone. Ownership of smartphones is highest among unmarried boys and lowest among unmarried girls. More than 2/3 of all adolescents watch TV at least once a week. Almost half of unmarried males and 1/5 of married and unmarried female adolescents access the internet at least once a week. 15 to 25% of adolescents have exposure to adolescent-related programs or materials through TV, radio, online, or print media. A large proportion of unmarried girls desire to know more about puberty, menstruation, and family planning. Also, a notable proportion of unmarried males want to know more about physical change, wet dreams, and family planning. The internet is the most preferred source of information on all health-related topics for the largest proportion of unmarried males. Unmarried females prefer to get information on menstruation and puberty through books and on family planning from health providers and books. Next, Noel and Logno will present in the survey results on menstrual hygiene.
Menstrual hygiene. We will be presenting on a very important topic, yet overlooked and stigmatized biological phenomenon of a woman's health, menstruation. We shall be specifically presenting about menstrual hygiene. Topics covered. Information on menstruation was collected from around half of the adolescent girls. We will be covering a number of topics relating to menstruation, namely, age at first menstruation, knowledge on menstruation, misconceptions about menstruation, product use during menstruation, and menstrual hygiene. We shall also be presenting school attendance during menstruation.
Age of first menstruation. Age at first menstruation signals the beginning of reproductive phase of a woman's life. The average age when ever married girls first experience menstruation is 12.8 years and 12.9 years for unmarried girls. Knowledge on menstruation. Although menstruation is a very natural event, only 23% of ever married and 30% of unmarried females had prior knowledge regarding menstruation before actually experiencing it. Out of those who had prior knowledge, only 41% of ever married and 37% of unmarried females claimed that their knowledge on the topic was adequate. Sources of information on menstruation. Textbooks and other books are the major sources of information for 65% of married females and 81% of unmarried females. 23 to 29% of the girls mentioned that they got their information from TV or radio. Much smaller proportions mentioned internet or newspaper and magazines to be sources of information on menstruation.
Misconceptions on menstruation. Different types of misconceptions prevail in the society as well as among adolescents. The most common reported misconceptions include menstrual blood is impure. 85 to 87% of adolescent girls agreed with the statement. One cannot eat anything sour during menstruation is also perceived to be true by 59 to 66 of the girls. Over half of the adolescent girls agreed with the statement that one cannot do any physical activity during menstruation.
Products used for management of menstruation. What do adolescent girls use to manage menstruation? Sanitary napkins and clothes are the two major products used during menstruation. Over 60% of the girls use sanitary napkins, and clothes were used by 51% of married and 57% of unmarried adolescents. Around 5% adolescents use cotton or toilet tissue for managing menstruation. Hygienic menstrual practices. The recommendation for hygienic menstrual practices state that the use of clean products during menstruation and the change of menstrual materials used at least 4 times a day. The change of menstrual materials at least 4 times a day is very important to prevent toxic shock syndrome during menstruation. Though the use of disposable or clean and reusable materials is very high among the adolescents, only 1 out of 10 girls changes menstrual materials 4 or more times a day. Our survey results show that only 9 to 12% of the girls are following hygienic menstrual practices.
School miss during menstruation. In this survey, 1 in 4 school-going adolescents reported to miss 1 or more days of school during their last menstrual cycle. Reasons for not attending school during last menstruation. The most common reason cited for not attending school during menstruation was having menstrual cramps or pains, followed by embarrassment and heavy bleeding.
In summary, the mean age of first menstruation is 12.8 years and 12.9 years for ever married and unmarried female adolescents, respectively. Most female adolescents had no knowledge about menstruation prior to experiencing it. Even those who did have knowledge, less than half of them claimed that they had adequate knowledge. Textbooks or books are the most common mass media resources of information for menstruation for girls, followed by TV and radio. Almost all adolescents reported using hygienic menstrual products like sanitary napkins or clean materials. But only 1 out of 10 girls changes menstrual products the recommended number of times, 4 times a day. As a result, only 9 to 12% of adolescent girls are following hygienic menstrual practices. 1 out of 4 female adolescents aged 15 to 19 years misses at least 1 day of school during menstruation. Our next topic is marriage. We invite Namir and Mihika to present the findings.
Marriage. A prominent yet seldom mentioned effect of marriage on adolescent girls is the premature loss of their childhood. At the ages when youth tend to explore, envision, and flourish, the responsibilities and boundaries set forth by marriage rather takes precedence. The questionnaire on marriage was administered to all ever married female adolescents and around half of the unmarried adolescents. Topics covered in this presentation are: for married female adolescents, information on marital status and duration, spousal age difference, and spousal separation. For all adolescents, their preferred timing of marriage.
Marital status and duration of marriage. In Bangladesh, 97% of ever married female adolescents aged 15 to 19 are currently married, and 3% are divorced, separated, or widowed. 17% of currently married girls aged 15 to 19 have been married for 4 or more years. Half of them are married for 1 year or less, and 1/3 are married for 2 to 3 years. Spousal age difference. Adolescent girls are married to adults, often with a large age difference. 30% of married girls have an age difference of 10 or more years with their husbands. Another 51% have an age difference of 5 to 9 years. Variation in spousal age difference by wealth. spousal age difference varies by a household's economic status. In the highest wealth quintile, 45% of the girls have husbands with whom their age difference is 10 years or more. In comparison, among the lowest wealth quintile, 20% of female adolescents have such an age difference with their husbands. Spousal separation. As for spousal separation, the survey looked into the proportion of married adolescents who lived apart from their husbands. Overall, 18% of married adolescents lived apart from their husbands, half of whom live in Bangladesh and the remaining living overseas. The proportion of married adolescents who live separately from their husband varies notably by regions of the country. It is the highest in the eastern region. 27% of married adolescents in the eastern region were living separately, compared to 21% in the central region and 11% in the western regions. Also, adolescents in the eastern region were more likely to have spouses living abroad than the other two regions.
Preferred timing of marriage. Ever married female adolescents were asked about their preference on the timing of their marriage in relation to the actual age at which they were married. About 2/3 of the married female adolescents stated that they would have preferred to be married later than the age at which they got married. Just under 1/3 felt that they were married at the right time. The preferred age of marriage in terms of unmarried female adolescents. The survey also asked unmarried adolescents to state their preferred age of marriage. Amongst unmarried girls, less than 1% preferred to marry before the legal age, which is 18 years for girls in Bangladesh. 42% preferred to marry at the ages of 18 to 19. About a quarter preferred to marry at the age of 22 or later. The preferred age of marriage in terms of unmarried male adolescents. 7% of unmarried boys preferred to marry before the legal age, which is 21 years for boys in Bangladesh. 38% preferred to marry at the ages of 21 to 23. Over half, that is 55%, preferred to marry at the age of 24 or later.
To summarize, 3% of ever married girls aged 15 to 19 are separated, divorced, or widowed. 17% of currently married girls have been married for 4 years or more. 30% of female adolescents have an age difference of 10 or more years with their husbands. The highest proportion of female adolescents with a spousal age difference of 10 years or more is among the highest wealth quintile. 1 in 5 married adolescents live separately from their husbands. Among those who live separately, half of the husbands live in Bangladesh and the other half outside of Bangladesh. Married adolescents from the eastern region are most likely to have husbands living separately and overseas compared to those from the central or the western regions. 2/3 of married female adolescents would have preferred to be married later than the age at which they were married. Over a quarter of unmarried females preferred to marry at the age of 22 or later. Over half of unmarried males preferred to marry at the age of 24 or later. We now invite Maisha and Nahian to present the findings on family planning and health services.
Family planning and health services. Adolescents are generally considered as healthy. However, they also have some special health needs which require easy access to information and services. The topics to be covered in this presentation are knowledge of family planning among unmarried adolescents, contraceptive use among currently married adolescents, sources of modern contraceptives, health service use in the last 6 months, source of health care, type of health service sought. Knowledge of oral pill, condom, and emergency contraception. Unmarried adolescents aged 15 to 19 years were asked about their knowledge of contraceptive methods. If any respondent spontaneously did not mention about oral pills, condoms, or emergency contraceptives, then they were prompted about these three methods. Spontaneous responses were much lower than prompted responses. The results shown here include both spontaneous and prompted responses. Among these three methods, unmarried female adolescents are most likely to have heard of oral pills. 72% are aware of this method, while among unmarried male adolescents, condom was the most well-known method. 82% have heard about it. Knowledge of emergency contraceptive pills was much lower among both unmarried males and females. Only 1 in 5 males knew about it, while only 1 in 10 females have heard about emergency contraceptive pills. Awareness about sources of contraceptive methods. The most widely mentioned source of contraceptive methods reported by unmarried female and male adolescents is the private medical sector. Knowledge of pharmacy as a source of contraceptives was predominant. Half of the unmarried girls and a quarter of the unmarried boys who are aware of contraception methods have the knowledge that public health facilities and providers offer family planning methods. Contraceptive use by currently married respondents. The contraceptive prevalence rate among currently married female adolescents aged 15 to 19 is 56%. Modern method use is 51%. Pill is by far the most widely used method, and 33% respondents used it, followed by male condom 9% and injectables 7%. Sources of modern contraceptive methods. 64% of currently married female adolescents obtain their methods from the private medical sector, the overwhelming majority from pharmacies. Only 19% of married girls obtain the methods from the public sector.
Health service utilization. 62% of ever married females, 50% of unmarried females, and 57% of unmarried males sought health care from health facilities or pharmacies or health providers in the 6 months preceding the survey. Sources of most recent health care. Adolescents sought care from a range of facilities and providers. The private sector was the most widely used source of health care for all the three groups of adolescents. The unmarried boys were more likely to seek health care from the private sector than the girls. Within the private sector, males were much more likely to seek care from pharmacies. 46% of boys received care from a pharmacy, compared to 17 to 21% of the girls. The public sector was the source of health service for around 1/3 of the females and 1/5 of the unmarried males. Types of health care sought. Overall, seeking care for general illness was most common among each of the three adolescent groups. Among ever married female adolescents, 41% sought care for general illness and 25% received maternal health services. Among unmarried females, 57% received services for general health problem and 11% sought vaccination services. 71% of the male adolescents received services for general health problem. 7% sought care for injuries or accidents, and another 7% for allergies, rash, or itches.
In summary, knowledge of pill as a method of family planning is higher among unmarried females than males. On the other hand, unmarried boys have higher awareness of condom as a family planning method than unmarried girls. The contraceptive prevalence rate among currently married female adolescents aged 15 to 19 is 56%. The pill is by far the most popular used method, 33% use it. The private medical sector is the source of contraception supply for 64% of married female adolescents who use contraception. The majority, 61%, rely on pharmacies.
In terms of knowledge and use of health services, we found that more than half of all adolescents visited healthcare facilities in the 6 months preceding the survey. The proportion ranges from 50 to 62%. Adolescents are most likely to go to the private sector for health services. Most seek healthcare for general illness.
Let us now move to our next session. And for that, please permit me to invite Armin and Namir to share the findings on adolescent nutrition with us all.
Diversified diet and optimum nutritional status have a significant effect during adolescence since it contributes maintaining a healthy weight, improving physical and intellectual performance, optimizing growth, and improving health. The questionnaire on nutrition and dietary diversity was administered to around half of the sampled adolescents. The topics that will be covered in our presentation are prevalence of stunting, underweight and overweight, dietary diversity in food consumption, and iron and folic acid supplementation.
Definitions. Stunting, which is assessed by height for age, is a measure of linear growth retardation and cumulative growth deficits. Adolescents whose height for age z-score is below -2 standard deviations from the median of the reference population are considered short for their age or stunted. Underweight or thinness is assessed by body mass index, or popularly known as BMI. Adolescents whose BMI for age z-score is below -2 standard deviation from the median of the reference population are classified as underweight or thin. Overweight is also assessed by body mass index, and adolescents whose age-specific BMI z-score is more than 1 standard deviations above the median of the reference population are considered overweight.
Stunting. Around 1/3 of female adolescents are stunted. Stunting among married females is slightly higher than the unmarried ones, 36% versus 32%. Stunting is lower among the unmarried male adolescents at 22%. Underweight and overweight. Only 4% of ever married female adolescents are underweight or thin, and 16% are overweight. 8 to 11% of unmarried adolescents are underweight, and another 9 to 10% are overweight. Overweight among adolescents by place of residence. The survey findings show that adolescents from urban areas are more likely to be overweight than their rural counterparts. 22% of married females living in urban areas are overweight, compared to 14% of those living in rural areas. Unmarried adolescents in urban areas are almost twice as likely to be overweight than those in rural areas.
Dietary diversity definition. Based on the definition of the Food and Agriculture Organization of the United Nations, adequate dietary diversity means consuming food from at least 4 food groups. The food groups are mentioned on this slide. Vitamin A enriched food was defined by consuming vitamin A rich dark green leafy vegetables, vitamin A rich yellow, orange, red vegetables, and milk or yogurt. And iron enriched food was defined by consuming grains, nuts or seeds, vitamin C rich vegetables. The information on dietary diversity was collected from accounts of food consumed in the last 24 hours as reported by the respondents.
Dietary diversity. 76% to 85% of adolescents consumed food that had adequate dietary diversity. The males are more likely to have adequate dietary diversity than females. 70% to 78% of adolescents consumed iron-rich food. Again, the consumption of iron-rich food is slightly better among males. 22% to 29% of adolescents consumed vitamin A-rich food in 24 hours preceding the survey. Iron folic acid. The National Strategy for Adolescent Health 2017 to 2030 states reducing anemia among adolescent girls and boys as one of its strategic objectives. To reduce anemia, one of the key approaches is to provide and promote micronutrient supplementation, including iron and folic acid, at health facilities, schools, and workplaces. Only 12% of ever married female adolescents received iron and folic acid supplementation in the 7 days preceding the survey. Among unmarried adolescents, the proportion receiving the supplementation is very low at 1% to 3%. In summary, around 1/3 of female adolescents and 1/5 of male adolescents are stunted. Around 1 in 10 unmarried adolescents are underweight and another 1/10 are overweight. 76% to 85% of adolescents consume food having adequate dietary diversity. Most adolescents, 70% to 78%, also consume iron-enriched food. But only around a quarter are consuming vitamin A-rich food. Lastly, the proportion receiving iron and folic acid supplementation is very low. Our next presentation is on gender norms. Ariza and Ahbab will present the results.
Gender norms. Gender norms are a subcategory of social norms that specifically describe various aspects of gender differences and define roles and actions considered acceptable for women and men in a particular society. Understanding various aspects of gender norms is imperative, so policymakers and program managers can help formulate appropriate strategies to ensure gender-based equality. In the survey, 8 statements were read out to 3 groups of adolescents. They were asked whether they agree or do not agree with these statements. The statements were written in such a way that agreeing to them indicated acceptance of norms, supporting gender inequality, and not agreeing to the statements reflected promoting gender equity. These statements were grouped under 4 main categories, each with 2 statements. The first category is male preference. It addresses 2 statements that indicate preference of boys over girls. The second group is mobility. It includes 2 statements that support gender-based mobility restrictions. The third group is household responsibilities. The 2 statements under this category indicate stereotyping roles and responsibilities based on gender. The last 2 statements were under spousal power dynamics. The statements reflect husband's authority over his wife.
Male preference. Let us now look at the result. The first statement says, a family is not complete until they have at least one son. Around half of the ever married girls and unmarried boys agreed with it. Comparatively, much smaller proportion of unmarried girls have the same view. Access to education is an important indicator to ensure gender equality. However, 65% of unmarried males agreed to the statement that it is important that sons have more education than daughters. On the other hand, girls, whether married or not, are much less likely to agree with this statement, particularly those who are not married.
Mobility. Half of the unmarried boys perceive that women should not be allowed to work outside of home. A notably smaller proportion of female adolescents have the same view. In the survey, 45% of unmarried male adolescents supported the statement that outdoor games are only for boys and not for girls, whereas less than 30% of ever married girls and less than 20% of unmarried girls agreed to the statement.
Household responsibility. The next statement was household chores are for women only, not for men, even if the woman works outside of home. Among the three groups of adolescents, the married girls are more likely to agree with this statement than unmarried girls or boys. For instance, 41% of married girls agreed with this statement compared to 25% of unmarried girls and 35% of unmarried boys. Another statement on household responsibility was looking after the household and kids is the responsibility of women only. Married female adolescents are more likely to agree to this statement. 24% of married females, 13% of unmarried females, and 18% of unmarried males agreed with the statement.
Spousal power dynamics. Over 60% of married females and unmarried males agreed with the statement, a woman should listen to her husband even if she disagrees. Nearly half of the unmarried females also agreed to the statement. However, adolescents were less supportive about husbands' authority to physically hurt their wives. Still, 1/3 of the married females, 1/5 of unmarried girls, and 1/4 of unmarried boys agreed to the statement that husband has the right to beat his wife when she does not obey him.
Composite index on gender norms. When perceptions about various gender norms were further analyzed, we see some interesting patterns. Among the three groups of adolescents, unmarried boys were most likely to agree with the two statements which supported male preference. Similarly, males were also most likely to support limiting women's mobility outside the home. Unmarried girls hold the most liberal views among the three groups of adolescents.
On the other hand, married women are most likely to agree with the statements that doing household chores and taking care of the family and kids are women's responsibilities. Similarly, the statements supporting women's submissive status to men are agreed by a higher percentage of married females compared to the other two groups. Again, here also, unmarried girls had the most liberal views among the three groups. In summary, unmarried girls hold the most gender equitable views and among the three groups. Agreement to all the statements is lowest for unmarried females. Married girls support the societal views about women's role in doing household chores and taking care of the family and kids, even if women work outside home. They also support women's submissive status to men more than any other group. Unmarried boys supported the importance of having a son in the family or higher education for sons compared to the other two groups. Similarly, opposition to girls playing outdoor games and women working outside home is more pronounced among male adolescents compared to the other two groups. The next topic for presentation is violence and sexual harassment. We invite Noel and Logno to present the results.
Violence and sexual harassment. Violence experienced by adolescents is a major public health concern. Violence can lead to various adverse consequences like injury, disability, psychosocial dysfunction, unplanned pregnancies, sexually transmitted infections, and chronic diseases. Moreover, adolescents who experience violence are more likely to later inflict violence upon their family members, partners, and children. Topics covered. The survey administered questions on violence to approximately half of the adolescents from each of the three groups. The questions on sexual harassment were only asked to female adolescents. Adolescents were asked about physical violence, verbal or social bullying, cyberbullying, and sexual harassment.
Physical violence and questions asked. Adolescents were asked whether in the 12 months preceding the survey they experienced any of the specific types of physical violence as mentioned and on this slide. When a respondent replied yes to any of these questions, he or she was then asked how many times it happened. Experience of physical violence. Unmarried males were most likely to experience physical violence. 1 out of 4 unmarried males reported having experienced physical violence in the last 12 months, while 18 to 20% of the girls said they experienced physical violence. The most common form of physical violence experienced was being slapped or pushed or pulled by hair. 4 to 6% reported experiencing physical violence 5 or more times in the past year. Perpetrators of physical violence. The perpetrators of physical violence vary for the 3 groups of adolescents. Among ever married females, husbands were by far most reported as perpetrators at 77%. Among unmarried females, 38% reported that mothers perpetrated physical violence. Other notable perpetrators were friends or classmates and siblings. Over half of the unmarried males reported that friends or classmates perpetrated physical violence. 1 out of 5 also reported that neighbors were perpetrators of physical violence.
Verbal bullying and questions asked. Adolescents were asked whether they had faced any form of verbal or social bullying in the 12 months preceding the survey, through the questions shown on this slide. Experience of verbal bullying. Overall, around 1/3 of adolescents face bullying. Unmarried males were slightly more likely to have faced verbal or social bullying than the female adolescents, 35 versus 30%. The most common form of verbal bullying was cursing, making mean comments, or name calling. Around 10 to 14% of adolescents had faced verbal or social bullying 5 times or more in the 12 months preceding the survey. Perpetrators of verbal bullying. Nearly half of ever married females reported that their husbands were the most common perpetrators, followed by their in-laws and other family members. Unmarried females reported that friends or classmates were the most common perpetrators, followed by mothers and neighbors. Nearly 2/3 of unmarried males reported friends or classmates as perpetrators, followed by neighbors and mothers.
Cyberbullying and questions asked. Adolescents were asked whether, in the 12 months preceding the survey, has anyone used a mobile phone or internet to harass or bother them, spread mean words about them, or shared pictures of them? When a respondent replied yes, they were then asked how many times it happened. Experience of cyberbullying. Cyberbullying is less common than physical violence or verbal and social bullying. Female adolescents are more likely to face cyberbullying than male adolescents. 7 to 9% of the adolescent girls faced cyberbullying compared to only 3% of the adolescent boys, even though female adolescents are less likely to own mobile phones or even have internet access. 1 to 3% of adolescents reported experiencing cyberbullying 5 or more times in the past 12 months. Perpetrators of cyberbullying. Unknown persons were by far the most reported perpetrator of cyberbullying among female adolescents, around 80% reported so. Unknown persons, as well as friends or classmates, were almost equally likely to be perpetrators of cyberbullying for unmarried boys.
Sexual harassment. Sexual harassment is a behavior characterized by making of unwelcome and inappropriate sexual remarks or physical advances. The questions asked on sexual harassment are stated on the slide. Experience of sexual harassment. Unmarried girls were twice as likely to experience any form of sexual harassment compared to married girls. 34% versus 17%. Of all forms of sexual harassment, girls were most likely to experience having been stared at in a vulgar way or being told suggestive songs or sexual comments or jokes. Location of sexual harassment. The location where female adolescents experienced sexual harassment varied, with the road being the most common place of harassment, 74% and 88% for ever married and unmarried females, respectively, reported so. Other common places of harassment were school, college, or madrasa. To be noted, 12% of married girls reported being sexual harassed at home.
To sum up, physical violence. About 1/5 of female adolescents and 1/4 of unmarried male adolescents have experienced physical violence at least once in the past 12 months. Around 4 to 6% of adolescents reported experiencing any act of physical violence 5 or more times in the past year. Perpetrators. The most likely perpetrators of physical violence for married female adolescents were husbands, for unmarried girls were mothers and friends or classmates, and for unmarried boys were friends or classmates.
Summary on verbal bullying. Around 1 in 3 adolescents experienced verbal or social bullying at least once in the 12 months preceding the survey. Unmarried males were more likely to have faced verbal or social bullying than the female adolescents. Around 10 to 14% of all adolescents have faced verbal or social bullying 5 times or more in the 12 months preceding the survey. Perpetrators. The two most common perpetrators of bullying for ever married girls were husbands and in-laws, for unmarried females, mothers and friends or classmates, and for unmarried boys, friends or classmates and neighbors.
Cyberbullying and harassment. 7 to 9% of adolescent girls experienced cyberbullying at least once in the 12 months preceding the survey. Only 3% of unmarried males reported experiencing cyberbullying. Unknown persons were the most common perpetrators of cyberbullying as reported by all adolescent groups. Sexual harassment. 1/3 of unmarried girls faced sexual harassment at least once in the past 1 year. Among ever married girls, this proportion was less than 1/5. Sexual harassment is most often experienced on the road. Our next presentation is on connectedness with family and friends. Nahian and Ariza are going to present the findings.
Connectedness reflects the emotional attachment, trust, and openness adolescents have in their relationships with family and friends, as well as to their broader peer group. Connectedness is an important protective factor for adolescents that can reduce the likelihood of a variety of health risk behaviors. The survey collected information to assess adolescents' connectedness with family and friends. We shall present findings on number 1, connectedness of married adolescents with their husbands and mother-in-laws, number 2, unmarried adolescents' connectedness with their parents, and number 3, adolescents' connectedness with their friends. Questions to assess connectedness. The level of connectedness with family was measured by asking 3 questions: whether the respondent enjoys spending time with the person, talks about very personal things with the person, and or feels pretty close to the person. All questions were asked on a Likert scale of never, sometimes, most of the time, or always. Respondents who replied always or most of the time to the questions are considered connected with the specific person. Those who responded never or sometimes are considered as not connected.
Connectedness with husbands. 66% of married girls said they enjoy spending time with their spouses always or most of the time. And slightly lesser proportion discuss very personal matters with their husbands. Over 80% of married girls reported feeling pretty close to their husbands. Connectedness with mother-in-law. Almost 3/4 of ever married female adolescents who lived with their mother-in-laws enjoy spending time with and/or feel pretty close to their mother-in-laws. However, less than 1 in 3 married girls discusses very personal matters with her mother-in-law.
Connectedness with mother, unmarried adolescents. Overall, a higher proportion of unmarried girls are connected with their mothers compared to unmarried boys, irrespective of the measure we use to assess connectedness. 87% of unmarried girls enjoy spending time with their mother. This proportion is much smaller, 65%, for boys. While over half of the unmarried girls talk about very personal matters with their mothers, only 1/5 of the boys do so. Over 90% of unmarried females and 80% of unmarried males feel pretty close to their mothers. Connectedness with fathers, unmarried adolescents. Around half of the unmarried female and male adolescents reported enjoying spending time with their fathers. And only a small proportion talk about very personal matters with their fathers. Around 2/3 of unmarried adolescents reported feeling pretty close to their fathers. Connectedness with friends. Among ever married females, almost half said they have close and trusted friends. Among unmarried girls and boys, a higher proportion, 60 to 66%, reported having close and trusted friends. Only 24% of married girls talk about very personal matters with their friends. In comparison, 43 to 45% of unmarried adolescents talk about personal matters with friends.
Summary. Connectedness with husband. 2/3 of the married women are connected with their husbands by the measure that they enjoy spending time with their husbands always or most of the time. However, a lesser proportion, 57%, said they discuss very personal matters with their husbands. Connectedness with mother-in-law. Almost 3/4 of ever married female adolescents who lived with their mother-in-law reported feeling pretty close to and/or enjoying spending time with them. A much lesser proportion, less than 1/3, reported discussing very personal matters with their mother-in-laws. Connectedness with mother. A very high proportion, 87% of unmarried girls stated that they enjoy spending time with their mother always or most of the time. Among boys, this proportion was 65%. Over half of the girls discuss very personal matters with their mothers, but only 1/4 of the boys do so. Overall, unmarried girls appear to be more connected with mothers than unmarried boys. Connectedness with father. Around half of the unmarried adolescents said they enjoy spending time with their fathers. Only a smaller proportion of unmarried adolescents discuss personal matters with their fathers. Overall, the percent of adolescents who feel connected with fathers is almost the same for girls and boys. Unmarried adolescents, both boys and girls, appear to be more connected with mothers than with fathers. Connectedness with friends. Unmarried adolescents are more likely to have trusted friends and discuss personal matters with friends than married girls of the same age. Our last presentation topic is mental health. We invite Shehreen and Namir to present the findings.
Mental health. In low and middle income countries like Bangladesh, mental health is an often ignored area in health programs. For adolescents, it is almost non-existent. While dealing with so many physical health issues, we often forget that the word health encompasses one's mental status as well. Looking into mental health issues in adolescence is pertinent as poor mental health during these bridging years of life is associated with a high prevalence of emotional, behavioral, and severe psychiatric problems during adulthood. The mental health section of the survey was administered amongst half of the survey respondents. The topics that will be covered in our presentation are depressive disorder, and connectedness with family and friends.
How depression was measured. For measuring depression, the Patient Health Questionnaire, PHQ-9, modified for adolescents, known as PHQ-A, was administered. This globally accepted and used instrument consists of 9 questions to measure the prevalence and severity of depressive symptoms. The questions closely follow the 9 criteria specified in the Diagnostic and Statistical Manual of Mental Health Disorders, also known as DSM-4 Diagnostic Manual. The 9 questions asked to assess mental health are mentioned on the slide. We asked whether they experienced any of these specific thoughts or feelings or behavior in the past 2 weeks preceding the survey. Each of the 9 questions had 4 possible responses. Not at all, some days, most days, and almost every day. Analysis. Responses to each question were scored between 0 and 3. Scoring was based on frequency of occurrence of the thought, feelings, behavior in the 2 weeks preceding the survey. Thus, from all the answers to the 9 questions, we could get a total possible score of 0 through 27. Assessment of depressive disorder. A total score ranging from 0 to 4 indicates no depression. If anyone's scores ranged from 5 to 9, it indicates minor depressive disorder. And a total score of 10 and above indicates major depressive disorder. The cutoff score point of 10 or more is used to define major depressive disorder, as global studies found that PHQ-9 with a score of 10 or more is a sensitive measure to identify depression needing clinical intervention.
Prevalence of depressive disorder. The survey findings show that 15% of ever married females aged 15 to 19 have major depressive disorder. This proportion is slightly lower for unmarried girls, 11%. Unmarried boys are much less likely to have major depressive disorder compared to the girls of the same age. 5% of the boys were found to have depression. Prevalence of major depressive disorder amongst adolescents by educational attainment. In each of the 3 adolescent groups, prevalence of depressive disorder is higher amongst adolescents with lower educational attainment. 18% of married adolescent girls with primary education or less have major depressive disorder, compared to 14% of those who have some secondary education or higher. For unmarried girls, this difference in prevalence of major depression by educational attainment is even larger, 18% versus 11%. Similar pattern is observed amongst unmarried boys, although prevalence of depression is much lower amongst boys than girls.
Connectedness and depressive disorder. In the next section, we shall review whether there is any association between prevalence of depression and adolescents' connectedness with family and friends. The indicator used here to assess connectedness with family is whether the respondent enjoys spending time with specific family members. For friends, the indicator which have been used are has close and trusted friends and talks openly with friends about very personal things. If the response to the above questions are always or most of the time, then we consider the adolescents to be connected with family or friends. Major depressive disorder and connectedness with husbands. The survey shows that married adolescents who are connected with their husbands are less likely to have major depressive disorder, compared to those who are not connected, 12% versus 19% respectively. Major depressive disorder and connectedness with mother and father. Unmarried girls who are connected with their mothers are less likely to have major depressive disorder compared to those who are not connected. On the other hand, the prevalence of depression among unmarried girls does not vary by the level of connectedness with their fathers.
Interestingly, there is no variation in the prevalence of major depressive disorder amongst unmarried males by their level of connectedness with their mothers or fathers. Now, we look at the prevalence of depression by connectedness with friends. First, we look at ever married females. Here, we see a different pattern. Married girls who are connected with friends are more likely to have major depressive disorder than those who are not connected with friends, 20% versus 13%. The same pattern also holds for unmarried adolescents as well. Unmarried females who are connected with their friends are slightly more likely to have major depressive disorder. The same pattern also holds for unmarried boys. 7% of unmarried males who are connected to their friends have major depressive disorder compared to 4% of those who are not connected.
To summarize, 1 in 7 married female adolescent and 1 in 10 unmarried girls aged 15 to 19 have symptoms of major depressive disorder. Girls are 2 to 3 times more likely to have major depressive disorders than boys. For all 3 adolescent groups, the likelihood of having major depressive disorder is lower among adolescents with higher educational attainment.
Married adolescents who are connected with husbands have lower prevalence of major depressive disorder than those who are not connected. Unmarried girls who are connected with their mothers are less likely to have major depressive disorder compared to those who are not connected. Prevalence of depression varies very little by unmarried girls' level of connectedness with father. Unmarried boys' connectedness with mother or father has no association with the prevalence of depression. Adolescents who are connected with friends seem to have a higher prevalence of major depressive disorder. This pattern is particularly notable amongst ever married adolescents. Thank you.
Ladies and gentlemen, and this was the last presentation for today. A big thanks to all the presenters for the analytical and informative presentation. You have definitely given us all plenty of food for thought, obviously. Now, with kind permission of the chair, we would like to continue to our next session, which is the question answer session. I would like to request our audience, if you have any more questions, please submit those in the question box for our expert panel to go through them. And
I think the who are the presenter, the little genius, special big hands for them.
Yes, agreed, completely agreed.
We are not yet finished with the little genius.
Yes.
Okay. When we talk about adolescent health, one thing that is said is talk to the adolescents themselves. So when we were planning for this survey, they were not involved with the survey. But when we looked at the results, we thought, let us get the adolescents for whom we have done this. And with COVID time, it has been hard to get, in touch with adolescents from all range of groups, which we hope to do in our later period. But as they came here, what we made sure is that they learn from the survey, some things and how they relate to it. And we ourselves wanted to learn from them too. So always, whoever we are involved with surveys, we always have questions about the various results that we see. And as we were working with them, we asked the questions that we had and had lots of informal discussions. And I just thought it would be nice to share with you some of the discussions that we have had with them so that you also understand their views on some of the results that we have seen today. So we will start and just share some of the, rich findings or their thoughts on these that I have come to know from them. We have a little time, not that much time, so we will just focus on certain aspects. Our first question to them was that, they come from Dhaka and they are all English medium students and they come from relatively well-to-do families. And our adolescents survey is really represents nationally. And I was just wondering that, does it relate to them? Can they relate to these findings? So I think our first question is to you. When you saw these results, could you even relate to it?
I think as surprising as it might sound, even though we are from a slightly better economic background, but আমরা যখন এই সার্ভে রেজাল্টসগুলো দেখেছি, we could relate to a lot of results regarding gender norms, regarding menstrual health, regarding violence and harassment, and মানে যে ইস্যুসগুলো আমরা যখন বড় হচ্ছিলাম আমরা জানতাম না, আমরা সেভাবে কখনো চিন্তা করে দেখিনি যে এই ইস্যুসগুলো হয়তো আমাদের লাইফে মানে আপকামিং স্টেজেস অফ লাইফে কতটা কাজে দিতে পারে, when we were going through puberty, when we were going through a change in our mental health as well. তো ইয়েস, আই এগ্রি, এই টপিকসগুলো নিয়ে যে এখন এই রিসার্চটা হয়েছে, দিস সার্ভে হ্যাজ বিন ডান, ইটস আ ম্যাটার অফ গ্রেট হ্যাপিনেস যে এখন অ্যাটলিস্ট এইসব বিষয়গুলো নিয়ে কথা বলা হচ্ছে। কারণ আমরা যখন বড় হচ্ছিলাম এই বিষয়গুলো নিয়ে খুব একটা জানতে পারিনি বা জানার সুযোগটা হয়তো পাইনি। আই থিঙ্ক মাই টিমমেটস উড ডেফিনেটলি এগ্রি উইথ মি টু।
ছেলে কিছু বলুক দেখি।
I'll definitely agree with Logno in this case, because দেখা যাচ্ছে যে while growing up and as we still are growing up, আমরা অনেক ইস্যুসই হয়তো ফেস করেছি যেটা just given the fact that we are from a relatively privileged background, আমরা খুব কমনের সাথে শেয়ার করতে পেরেছি বা নিজেদের সাথে হয়তো রেখেছি ব্যাপারগুলো। But seeing the data in the surveys and the results and the findings, we can see যে a lot of the problems we faced, a lot of the proportion of the entirety of Bangladesh has faced as well, especially people of our age groups. So যখন দেখতে পাচ্ছি যে now we can relate our experiences to people of the same age or relatively the same age in the entire country, it first of all makes us feel a bit comfortable that yes, we are not alone. And second of all, it gives us hope as well. যে এইসব ইস্যুস নিয়ে এখন যেহেতু কথা বলা শুরু হচ্ছে, hopefully things will get better and we will get stronger as well.
Okay, I'm going to skip some topics and just go to the topics where we had lots of discussions. So one thing that comes out is the need for information. We have seen that quite a large proportion of the adolescents have said that they want to know about physical changes, puberty, menstruation, family planning. And we had some discussions and there was some interesting for me to learn from you. So could you just share some of those with the audience?
Yes, I definitely agree that there is a very large knowledge gap on these topics, especially menstruation, because even though we come from relatively privileged backgrounds and we also live in the capital city of the country, we still don't have access to as much information as we need at the right time. Because from my personal experience, a lot of girls who I've talked to have experienced their first time without knowing what it was. And if you put yourself in their shoes, then you will be able to realize how traumatizing and scary that experience may be. But I would say that we are relatively lucky because our parents and our friends, they are educated enough যে তাদের সাথে openly discussion করা যায়. But for many girls, this is not the reality. And this topic is very stigmatized and tabooed for them, so they can't get their questions answered. And they don't have enough knowledge on topics such as menstrual hygiene, how to use sanitary products properly, and how to manage premenstrual syndrome. And they have to carry out their daily activities and get on with their life in a lot of embarrassment, pain, and discomfort.
Ariza, আমার মনে আছে তুমি একটা স্টোরি শেয়ার করেছিলে. Will you share that?
Yeah, so as Armin said, that we don't have the adequate information, and what it does is it just makes us afraid of this whole thing when it's a very natural thing. And as Armin mentioned, that we are still lucky and privileged that our parents are educated and they can tell us. But I remember Akbar, one of my housemates, she came up to me and she asked me, "Je, meder keno eta hoy?" Right? And she said it in a way that it's a curse for women. And she has her own child, and she was telling me, "Je, keno amader etai hobe? Keno?" And I tried to explain to her that this is not a curse. This is a very natural thing, and this actually gives us the ability to, reproduce. And I tried to explain a little bit to her, and she understood, and she was very surprised because she had no idea. ও জানতোই না যে কেন এটা হচ্ছে, and ও মনে করতো যে এটা হচ্ছে একটা punishment from God for women. So yeah.
I was wondering, যে স্কুলে তো তোমরা যাও, স্কুলে as a part of it পড়ানো হয়?
Auntie, I'd like to talk about that. যে হচ্ছে আমাদের স্কুলে usually biology books এ sexual reproduction in humans এর চ্যাপ্টারটা আর কি অনেক সময় staple করে দেওয়া হয় আর বলা হয় যে তোমরা নিজেরাই বাসায় পড়ে ফেলো। And the thing is, যখন আমরা details actually পড়ি এটা biologyতে, it's in 9th or 10th grade. But by that time, most of us girls have already had to encounter all those terrifying thoughts and feelings and fears with our first period. And by that time, it's just too late. All the information we can gather around the age of 12.8 and 13 years is mostly from our friends, from side talk and conversations, because often our teachers might feel uncomfortable sharing with us about what's actually happening. And our parents, on the other hand, aren't sure how to put it forth to us and might be hesitant to do so. And thus, because of this, and because of the cultural taboo it has become, we are left in such a baffling position that we don't understand how to deal with this. And in return, we have to be embarrassed. We think we have to be embarrassed about such a natural process of our bodies.
I would like to add to that by saying that I think in our society there is this idea that boys don't need to know about menstruation because ওদের সাথে এটা হয় না. But and as Maisha already mentioned, the pages in our textbook are stapled, and অনেক সময় বাবা মা এবং টিচাররাও এটা নিয়ে কথা বলতে চায় না. But that doesn't mean that boys' curiosity goes away, and they often look for other sources for information. And if they don't get the most accurate information, they might get misconceptions about menstruation, and they may make insensitive jokes about it. And I think that all this could be avoided if boys were given access to the right information from the right age.
How about boys facing, physical changes? তোমাদের কি ওটা সম্বন্ধে information থাকে? How did you grow up with it?
Auntie, I would like to talk on this topic by saying that we weren't given enough information about the changes that were about to happen in our body. We were terrified at an age. I'm sure all the members of my team, the boys, would agree that we had no proper knowledge. Amra jantamai na, auntie. We were given the conception যে eventually body যখন grow করে তখন এগুলা হয়, but not how these function or how we are going to face these situations. But due to this survey, now এই topicsগুলোর উপর যেহেতু light পড়ছে, I think this is a very good opportunity for us to realize how important such a topic is.
I sincerely hope we can bring more adolescents as we speak about these topics, and we hope to do so because this today what we have presented is such a large array of topics. It's not possible to cover in one seminar. So we will hope to have a series of discussions where we will bring people who are working on those topics, and also bring maybe a more variety group of adolescents and also parents to hear from them and move forward. We will now move to the next topic, which we have discussed quite a lot also on gender norms. I was kind of, when we were looking at the data, and I was thinking, well, this is the younger population, and they're different, and things have changed a lot, and I was a bit disappointed. I know we have made a lot of changes. I know we have become much better in sex preferences, like now a lot of families also want a daughter. But I was still a bit disappointed in looking at it because I was expecting it to be much better. What are your thoughts?
I wanted to say gender norms is definitely a very deep-rooted issue in our culture. And I think I speak for everyone here when I say we have at least experienced or witnessed gender norm in our lives. And আমাদের ক্ষেত্রে যদি বলি যে we have a subject in our school known as home economics. তো এই সাবজেক্টটা ইজ ইনক্রেডিবলি জেন্ডার বায়াসড, কারণ ইন দ্য সেন্স যে মেজরিটি মেয়েরাই এই সাবজেক্টটা পড়ে। তো ইউ ক্যান সি যে ছেলেমেয়েরা যখন দেখছে যে স্কুলে মেয়েরাই এই সাবজেক্টটা নিচ্ছে, তাদের মাথায় একটা সেন্স চলে আসে যে আচ্ছা, মেয়েরা হোম ইকোনমিক্স পড়বে মানে মেয়েরা সেলাইয়ের কাজ শিখবে, হেন্স মেয়েরাই ঘরের কাজ করবে। তো এগুলোর জন্য আরেকটা জিনিস যেটা আমি অ্যাড করতে চাচ্ছি যে যেই মেয়েরা আমরা মেয়েরা যারা সাধারণত একটু আউটগোয়িং বা ইন্ডিপেন্ডেন্ট আচরণ করি, উই আর সাবজেক্ট টু আ লট অফ গসিপ অ্যান্ড ক্রিটিসিজম। আমাদের অনেক কিছু শুনতে হয়, যেমন মেয়েটা রান্না বাড়া না করে খেলাধুলা করছে, বাইরে ঘোরাঘুরি করছে, তাকে বিয়ে কে করবে। সো when a girl hear phrases like this, সে ইজিলি ডিমোরালাইজড হয়ে যায়। মানে সে যে এই সোশ্যাল নর্মগুলোকে কমব্যাট করবে, সেই এনার্জিটাই এক পর্যায়ে চলে যায়। হেন্স মেয়েরাও এক পর্যায়ে গিয়ে বিলিভ করা শুরু করেন, না আমি অন্য ইন্টারেস্ট পার্সু করা শেষ না করি, আমি ঘরের কাজই করি। অ্যান্ড আই থিঙ্ক দিস ইজ পার্টিকুলারলি ট্রু ফর ওমেন যারা স্পোর্টসে ইনভলভড। And I think আমাদের মধ্যে Rahila, you used to play sports in your school. You can add something here.
Yeah, well, me being in the sports team, আমি যেটা দেখেছি যে আজকাল ছেলে আর মেয়ে দুইজনই এক্সট্রা কারিকুলার অ্যাক্টিভিটিসে একদম পার্টিসিপেট করছে, কিন্তু ওয়েন ইট কামস টু আউটডোর স্পোর্টস তখন দেখছি যে মেয়েদেরকে খুবই লিমিটেড অপরচুনিটিস দেওয়া হচ্ছে। ইভেন ইন স্কুলস আমি গিয়ে দেখি যে মেয়েরা প্র্যাকটিস করছে, যখন আমি প্র্যাকটিস করি পুরা টিমে জায়গা দেওয়া যায় না এরকম অবস্থা, কিন্তু যখন টুর্নামেন্টসের টাইম আসে ওই প্ল্যাটফর্মটাই মেয়েরা পাচ্ছে না, যে there is a girls team, only the boys team are going for the tournament. So এটা খুবই রেয়ারলি হয় যে খুব ভালো একটা মেয়েদের টিম ফর্ম হয়ে টুর্নামেন্টস খেলতে যাচ্ছে। And there are also some issues like মেয়েরা স্পোর্টস গিয়ার পরে, অবভিয়াসলি স্পোর্টস খেলতে হলে পড়তে হবে, দেন চুল কেটে ফেলে কয়েকজন মেয়ে, যে এত খেলাধুলা পড়াশোনা তো চুল আর মেনটেন করতে চায় না। তো তখন ওদেরকে বলা হয় যে ছেলে ছেলে ভাব চলে আসছে, এই মেয়েটা তো চুল কেটে ফেললো, মেয়ে মেয়ে ভাবটাই তো চলে গেল। আবার উইচ মেক্স মি ফিল রিয়েলি স্যাড, যেটা হচ্ছে যে মেয়েদেরকে আর কি ওদের স্পোর্টিং পারফরমেন্সের চেয়ে এটা দিয়ে জাজ করা হয় যে ওরা তো ছোট ছোট শর্টস পরে খেলতেছে, ওরা জার্সি পরতেছে। অ্যান্ড হয়তো স্কুল টিচার্স আর গেমস ডিপার্টমেন্ট অ্যান্ড অলসো প্যারেন্টস দে আর ভেরি সাপোর্টিভ, কিন্তু কতজন প্যারেন্টস যারা স্কুলে আনতে যায় ওনারা আর কি বলে যে আমার মেয়ে তো এটা পড়ে না, আমার মেয়ে তো খেলে না, এগুলো ভাবি, এগুলো অনেক কিছু বলে দেয়। সো এরকম হতে হতে হয়তো মেয়েটা ভালো খেলে, কিন্তু ফ্যামিলি সাপোর্ট না পাওয়ার জন্য ও টিমে থাকতে পারছে না। আই থিঙ্ক মেয়েদেরকে আরও এনকারেজ করা উচিত আউটডোর স্পোর্টসের জন্য। আই থিঙ্ক দে ক্যান ডু রিয়েলি ওয়েল।
How about someone from the boys speak out about gender norms? আমরা যেটা দেখেছি।
Yes, Auntie, I had something to say here. Gender norms এর data থেকে, from what we can see.
একটু ইংলিশেও বলো।
Yes. From the data that we can see in terms of gender norms, I feel that it negatively affects boys or males as well, in the sense যে ধরেন আমরা for example অনেকেই আছি এখানে, especially the boys I think can relate to this, যে from the very essence of our childhood we've been having to hear যে you're the one who needs to earn for the family in the future, you're the one who needs to work hard and make your family, and if you mess up তাহলে your family's future will be messed up.
So at a time when we are supposed to only worry যে আজকে ফুটবল ফিল্ডে আমি কি আমার বল নিয়ে আসবো নাকি আমার ফ্রেন্ড বল নিয়ে আসবে, but at a time when we're supposed to worry যে আজকে ক্রিকেটে আমি কোন ব্যাটটা দিয়ে 6 মারবো, তখন we're having to worry যে আমি 10 বছর পর আমার ফ্যামিলির জন্য কিভাবে আর্ন করব, বা how am I supposed to make my family. So all this contributes to the sense যে না, suppose এখন আমি যেমন স্কুলে যাচ্ছি, বা a lot of us we are in schools and other educational institutes, we feel the need to earn more rather than actually go to school or our institutes and earn education, because ওখানে তো টাকা খরচ হচ্ছে. And instead of that, if we get another form of job, let's say, so we can earn money. So I think this can contribute a lot to the high dropout rates that we have also seen. That'll be all from me, Auntie.
And also the feeling that boys need to study more than the girls. I'm just going to switch to another topic right now, unless any of you want to urgently say something on this topic. Let's move to something where we have talked about quite a lot about violence and sexual harassment. Who wants to start?
Since the topic of violence and sexual harassment is on the table, I think no one in this room, very rare few lucky women would, but no one else in this room would disagree jodi ami boli je being a woman, one of us at least once in our life has been subject and victim to sexual harassment. Everyone would agree to this because I personally have been too, and I think all my teammates would agree to it too. So আরেকটা জিনিস হচ্ছে যে আমরা যখন ডেটা দেখছি যে সেক্সুয়াল হ্যারাসমেন্টের সবচেয়ে বেশি কোন জায়গাগুলোতে হচ্ছে, we see that they're happening in the streets, in the roads. আমরা তো যদি ডেভেলপমেন্টের দিকে আগাতে চাই, আমরা তো ঘরে বসে থাকতে পারবো না, আমাদেরকে তো রাস্তায় বের হতেই হবে। আর যদি রাস্তাঘাটে আমাদের জন্য সেফ না থাকে, সেটা তো মানে দ্যাটস ভেরি স্যাডেনিং। আর আরেকটা ভেরি সারপ্রাইজিং point on violence was যে married women suffer the most violence and their most common perpetrators were husbands, which is a shock. It's unbelievable. If women are not safe on the streets, if women are not even safe at their own homes in the comfort, when are we safe? Where are we safe? আমরা তাহলে কিভাবে আগাতে পারবো যদি আমরা কোথাওই সেফ না থাকি? যে wherever we go we have to keep this in mind যে we might be subject to violence at any point of our lives. এই চিন্তাটা যদি আমি কনস্ট্যান্টলি মাথার মধ্যে রেখে আগাতে থাকি, তাহলে how will we go towards progress? How will we think about making ourselves better? And this is something I just wanted to share.
Yeah, so as Lognapu said, I think, yes, every one of us can relate to this. And I think amader country te, one of the biggest problems is that we don't consider staring in a vulgar way or, passing comments on the streets as sexual harassment. Unless you touch someone in an appropriate way, it's not considered to be sexual harassment. And as she said, like, we all face it. Jokhon I walk on the streets and I see people staring at me or passing comments, my first instinct is, have I done something wrong to trigger such reaction? Am I wearing the proper clothes? And I think this is the main problem in our society because amader moddhe they have inculcated this mindset that if something is wrong, it's probably the fault of the girls. And say if we protest or if speak up, I have been subjected to this harassment or whatever, the first thing that people will ask me, what were you wearing? Did you have orna? Were you covering yourself up? And I think this is a big issue because people engage in victim shaming instead of questioning the offenders. Ar eta hocche oderke aro enable korche, which is further aggravating this problem. So this is what I feel.
Okay, I'm going to move from sexual harassment because we'll never stop there. So maybe talk a little bit about violence. We talked about physical violence and
Auntie, I had to share something. Is that culturally, আমরা দেখতে পারি যে hitting your child is seen as a form of disciplining them. But there's always a fine line between disciplining your child and violence. Of course, বাচ্চারা দুষ্টামি করবে, মা বাবা একটু মাইর দিবে, that's normal. But there's always a limit when disciplining your child turns into your child becoming indifferent or getting distant from you. And I think the solution to this is proper communication. Communication is always key. And I think if such actions do take place, parents should be considerate and have a proper talk with their children to like bujhak why they did what they did. And I think that would make a big difference, and I think it's really needed.
Abba, by the way, is the youngest in the group. He's in grade 8 and he talks like a guardian. I think Shireen wanted to say something about bullying.
Yes, I wanted to shed some light on the topic of bullying. আমরা তো সবাই, I don't know, more or less we have been subjected to some sort of bullying, either at school or inside our homes, be it for our appearance or for the way we act, for being timid, or মানে পড়াশোনায় ভালো করলেও দেখি যে আমাদেরকে বুলিং করা হচ্ছে। তো ছোটবেলায় এটার যতটুকু না প্রভাব পড়ে, বড় হওয়ার পরে হচ্ছে সে যখন একজন অ্যাডাল্ট হলো, somehow that person suffers from lack of self-confidence or has anxiety and depression. তো যেসব এই একটা ছোট জিনিস যেটা আর কি ছোটবেলায় প্রিভেন্ট করা যায়, সেটার কারণে বড় হয়ে তার এত ধরনের সমস্যা দেখা যাচ্ছে। এটা কিভাবে আমরা অ্যাড্রেস করব? স্কুল থেকে নাকি বাসায় কিভাবে মেসেজটা পৌঁছাবো, এটা নিয়ে এখনই চিন্তা করা উচিত।
I've been told I have to finish it fast, so I'm going to just move to mental health right now. And I know we have had some discussions. Who would like to start?
আন্টি, আমরা বাংলাদেশে দেখতে পারি যে most people think যে mental health বলে কিছু যে একটা আছে, it doesn't exist. And mostly parents তাদের বাচ্চাদের বলে যে I've given you such a privileged life, you have food on your plate, I'm sending you to such good schools, তোমার কি প্রবলেম থাকবে? But that's not the case. It's যে আমাদের সব প্রবলেম যে ফ্যামিলি রিলেটেড হইতে হবে, that's not necessary. We could have other problems too, and we are progressing. I'm not going to deny that. The topic is coming to light, and mental health is a topic which is not talked about enough, and it is not paid much attention to.
Auntie, I wanted to add something, and this may be a bit contradictory to Abba, but I love you, man. Don't worry about it.
Thank you. I love you too.
My man. So, Auntie, what I wanted to say was, I'm not necessarily in full belief that our parents আমাদেরকে বুঝে না। হ্যাঁ, I think we have all shared those moments where we felt যে আমাদের elders বা আমাদের parents যেই হোক না কেন, relatives আমাদেরকে বুঝতে পারে না, they don't understand the things we're going through. However, I do feel that yes, they do understand, but the thing is they can't relate to it in the sense because there is a generation gap, and they also have faced their share of issues as well. And hoyto they may have had their own ways of dealing with it, jeta hoyto amra we don't understand. But hoyto I have my ways of dealing with it, which they don't seem to understand. So in a manner, I feel that there is a responsibility in both sides where a connection has to form. Amaderও যেরকম ওদের সাথে connect করতে হবে, we have to be vocal that this is what works for me. And I also have to be recipient from them that Baba, this is what's going on and this is how it works for us. And evabe we can communicate so that there's a common point and we can move forward.
Okay.
Yes, exactly. I agree with Namir. Like আমি একটা ইনসিডেন্ট বলতে চাই about this. আমি একদিন আমার বাবার সাথে কথা বলছিলাম and I just said him যে আমার কেমন ডিপ্রেস লাগছে, আমার কিছু ভালো লাগছে না আজকে. So he was like যে আরে কোনো সমস্যা নেই, তুই আমার সাথে এসে একটু কমলা খা।
The data shows that boys especially don't talk to their mothers or their fathers. So you go to your friends?
জি আন্টি, এই ক্ষেত্রে আমি যেটা বলতে চাই যে even though it shows that we go to our friends, but I would like to share my personal experience. আমি যদি আমার ফ্রেন্ডকে গিয়ে বলি যে I am feeling depressed or mentally unsatisfied with something, the first thing they're going to say, advise me, is that দোস্ত তুই বাসায় গিয়ে একটা সুন্দর ঘুম দে, খুবই ভাল লাগবে ঘুম থেকে উঠে, তখন সব ডিপ্রেশন চলে যাবে। And it's not given enough importance at all. But I think due to the survey, a lot of things are coming in knowledge now, right, guys?
I think I'm going to
definitely.
let Mihika say something, and then we have to close it today. And so, Mihika?
Yeah, I just wanted to say that আমরা যখন আমাদের প্যারেন্টসকে গিয়ে বলি যে we are feeling physically unwell, তখন our parents are not the ones that diagnose us. তারা আমাদেরকে একজন ডাক্তারের কাছে নিয়ে যায় বা একজন ডাক্তারকে স্ট্রেট কল করবে। কিন্তু আমার কোয়েশ্চেন হলো, মানে this is not a problem. I'm not saying that this reaction is bad, but what I'm saying is যে why do we not get the same reaction when we go and say যে we are mentally unwell? When we go to our parents and amra boli je we are feeling mentally down but depressed and having anxiety, I think there are two things that we must recognize here. Je, on the one hand, we are definitely not qualified enough to diagnose ourselves as mentally ill. Kintu on the other hand, our parents are also not qualified enough to say that we are not mentally ill. সো আমি মনে করি যে যখন আমরা এরকম মেন্টালি মানে সিমটমস দেখাই, খারাপ সিমটমস দেখাই, why is it not যে our first reaction is যে একটা প্রফেশনালকে আগে কনসাল্ট করে নেই? So that's why I think যে in our country মানে সিকিং থেরাপি বা কাউন্সেলিং এগুলো আরো নর্মালাইজ করা দরকার। And I'm hopeful যে with the coming generation আস্তে আস্তে জিনিসটা will receive more attention আর চেঞ্জ আসবে।
Thank you. I don't think anybody could have put it better. So I enjoyed so much working with them, and I hope you have enjoyed listening to them. Thank you.